Today we're going to talk about palliative medicine, which I'm guessing a lot of people don't really know what it is, who it's for, how do you get it? So if you want to know more about that, just stay tuned. Hey, good morning, everyone, and welcome to Scan FYI. So my guest today is Dr. Keith Pasichow. Good morning, doctor.
Good morning. How are you?
I'm good. And you are the director of palliative medicine at Monmouth Medical Center. And like I said, I always feel this is a word people hear, but they're not 100% sure what it is. Does it pertain to me? Is it for you? What the heck is it? So that's what we're
Sure.
going to talk about today. So first, would you just kindly introduce yourself a little more and what is your role as director of palliative medicine?
Sure. So I'm Dr. Keith Pasichow. My role as Director of Palliative Medicine covers a couple of different things. The part that I enjoy the most is being able to see patients and take care of patients, both in the clinic and in the hospital. The other piece to my role as director is to help build the program. And so doing things like this, which are educating the public about what palliative care is and how it's appropriate for them, how they access it, and then doing similar education for a lot of our colleagues in the hospitals and in the community. The one of the problems with palliative medicine is that a lot of physicians and nurses don't fully understand what we do. And so their theories about it tend to be a little older. And so we do a lot of teaching about what it really is and how we can be of benefit to the vast majority of the patients that they're seeing.
All right, well, Scan FYI, we are really all about community education. And as I said, I feel like people know the word, but they don't really know what it is. So let's start by defining it. What is palliative medicine?
Sure. So palliative care and palliative medicine really came out of a movement that started in about the 1940s, actually over in England. And the goal of that movement was to focus on the quality of life that patients experiencing a chronic or serious illness were facing. There was a huge push on the medical side to really extend people's lives and to be able to cure these diseases, but we weren't as focused on the quality of life that people were having during the process of that. And so
Right.
that's where palliative medicine came in. So our role as part of the treatment team is to focus on a holistic view of the patient and the family. We talk about the psychosocial aspects of care. We talk about the barriers that may exist to care. Those may be financial, they may be housing, they could be food, they could be psychological, any number of things. We also focus on the symptoms that patients are having. So one of the great things about modern medicine is we can keep people alive for decades longer than we ever expected, which is terrific, except we're finding that people tend to have a lot of symptoms as they go through these diseases. Things
Yeah.
like shortness of breath, things like pain, nausea and vomiting, itching, all sorts of symptoms. And so palliative medicine, we're the specialists that focus on addressing those symptoms in a way that allows patients to continue receiving their disease treatment for as long as they would like to. So that's a little bit about what palliative medicine does.
Right. I had no idea it had been around since 1940s. Sorry, we learned something right there. But
Mhm.
now I feel like a lot of people feel like you would only be getting this kind of care if you're sort of in an end of life situation. But I'm listening to you, it does not seem that that is true.
Correct. So that misperception comes out of the hospice field.
Right.
Hospice
Right.
is something that a lot of people have heard of, and it's an absolutely magnificent service. It focuses very intensely on quality of life in the last few months of a patient's life. And it really makes a huge difference in people's lives. Palliative care is similar in the sense that we focus on that quality of life, but our focus is throughout the disease spectrum. So whether you have a disease like cancer that may be cured, or a disease like COPD or heart failure, where you can live for decades, but the disease itself is progressive, palliative care can still have a large impact on your ability to tolerate those treatments and to have that positive outcome that everyone's looking for. So whether you're going to be cured, whether we're going to see you for decades, or
And
whether you're towards the end of life, palliative care can really make a huge impact on your quality of life throughout that.
so how do you wind up in a situation where you receive this care? Do you have to ask for it? Will it automatically be given to you?
So our goal in life is for it automatically to be available to everybody that's diagnosed with any sort of chronic illness. The reality is a little bit different.
Ah, it
So
always is.
that's true. Many patients either have to ask for it or have to be in a situation where they're lucky enough that one of their nurse practitioners or physicians thinks to order it. So my recommendation for patients is if you're under treatment for any sort of chronic or life-threatening illness, that you say to your physician, look, I'd really love to talk to palliative care. And I would expect that most of them are going to say, you're not there yet. And what they're really thinking is hospice. You may not be at hospice yet.
Oh, hmm.
But ask them specifically for palliative, and you can explain to them, no, no, I'm not looking for hospice. What I really want is palliative care so they can help me have that quality of life for as long as I'm able to stay on this treatment. And some physicians are going to give you pushback, and that's okay. You can always reach out to us. We'll make sure that our contact information is available.
Absolutely. All the contact information is below. Absolutely. Yes.
And we're happy to reach out to the doctor and have a conversation to explain what it is that we actually do. Um, if you're in the hospital, it's a little bit easier to get us involved. Just let your team know that you want to see us. And those are sort of the two ways that people come into the palliative care realm.
It's not automatic. That's not good. So,
Unfortunately not.
once again, we have to be our own advocate and educating people that it's even available to them, but you have to ask for it. Okay, so all right, that's if you're out there and you're listening, that's really important to know. Okay. And fortunately, depending on where you live, I mean, you're associated with Monmouth Medical Center. Obviously, they have this in place. So that makes us fortunate down at the in Ocean and Monmouth counties that we have access to this.
Yeah. Yeah, there are some places where palliative care is not as readily available. There has been a move towards expanding palliative reach, sorry, through telemedicine. So a lot of the larger programs are starting to do that. And we certainly look to do that in the future. Right now, we don't have the staffing to be able to handle those numbers, and we want to make sure we're giving the best care possible to everyone that we see. So some are available by telemedicine. There are also programs like the VNA. We work very closely with them, and they do have home-based palliative care. So if you can't get out of the house, or if you're stuck at home for the majority of the time, they're able to help come out to the house and see you there. And anyone who reaches out to us will help you find whatever resources are available to you.
So, Dr. Pasichow, can you give me some examples of a particular illness and what palliative care could do for you to make your life better I get it, while you're kind of going through the storm.
Absolutely. So I think everyone's first thought is cancer, because we all know that there's a lot of symptoms involved there. And so with the patients that we see who are going through cancer treatment, again, whether they're going to be cured or not, we do a lot of pain management, a lot of focus on nausea and vomiting, and we're able to get people to a point where they are comfortable enough to stay on their treatment regimen for longer. There's actually a couple of studies that come out that have shown that people who access palliative care earlier on in their treatment plan, even if the cancer is not curable, have a significant survival benefit. In stage 4 breast cancer patients, it was shown to be about 14 months, and that's just with having palliative care involved. And I think that's because we focus so much on that quality of life and the symptoms, so we allow people to stay on treatment and on course much, much more consistently. But diseases like heart failure, like COPD, we do a
Mhm.
lot of work with patients that are short of breath, people that have a lower exercise tolerance because of their heart failure or their COPD.
Right.
And we use all sorts of medications, and I won't go into detail right now because it's individualized, but all sorts of medications that a lot of other specialties don't think of that really can help people breathe more comfortably and therefore be much more active for longer, be able to stay on those disease controlling medicines for longer, be able to do more things outside of the home that they may be currently struggling to accomplish.
So you're really taking a very holistic approach to each person. Uh, I mean, obviously, this is a very individualized treatment,
Yeah.
that's interesting. Yeah.
Of course.
So I guess if you're really, when you're feeling that badly, if you're going through chemotherapy and that sort of thing, maybe you're not going to even want to continue with the treatment. And this getting palliative care could make all the difference in staying on course and
Abs-
ultimately becoming cancer-free.
Yeah, for those patients that have a curable disease, absolutely can make a difference. And even for those whose disease may not be curable and may just be manageable, meaning we can keep it stable for long
Right.
periods of time. There's a lot of times where the symptoms are so overwhelming that people are talking about, stopping treatment. I don't want to do this anymore. I can't live this way anymore. And we certainly respect everyone's right to make those decisions whenever it's appropriate for them. But one of the things that we do when we get involved is we say, okay, let's find out what your goals are. Do you want to be able to participate in certain activities? Are there certain upcoming events you want to be able to get to? Is it just a general quality of life that you're looking for? And we work with you to come up with a treatment plan to get to those goals and to meet that quality of life. And in many cases, patients say, you know what, I'm feeling a lot better. I think I'm okay continuing with the chemotherapy or the therapy for my lungs or my heart. So it really is about giving the patients every opportunity to do whatever is right for them throughout the process.
And it sounds like it's also more than just prescribing additional medications. Yeah, because, what, what are some of those other kinds of things that you might offer a patient? Non-drug things.
Non-pharmaceutical, as we like
Yeah,
to say,
that's the
yes.
word, right.
Yeah, so medications do play a role. But with
Of
everything,
course.
every medication has side effects, and so it's always a balance. So in addition to medications, which is sort of my focus on the field as the physician, we also do a lot of work with social work, so a lot of talk therapy, not just for patients who are depressed, but for people who just need to talk through to be able to deal with the fact that they were just diagnosed with this illness or to be able to talk
Right.
about the struggling that they're going through. And along with that comes the ability to help with any barriers that exist out in the community, financial, disability related barriers. A lot of people don't realize that there are a lot of resources available to them. And so that's something that palliative care often gets involved in helping with. We also interact very closely with chaplain. And for people who are religious, there may be a person in your religious community that you're working with. Our chaplain can supplement that. If you're not very religious or you don't have a community that you're part of, our chaplain can take over that role as well. And even for people who have no religion whatsoever, the work of the chaplain is not to support or defend religion. It's really to work with you on those existential things. Why is this happening to me? Did I do something wrong about this? It's a very, very common feeling amongst people who have a chronic illness.
Right.
And so chaplain's very good at working with that. So there's a lot of resources outside and a lot of different modalities that people can access. Pet therapy and um, I'm trying to think of the sense therapy, and I'm blanking on the name
Oh,
for it right now.
therapy.
Aromatherapy, exactly. Thank you.
That's why I'm
Um,
here.
that's and I think actually that illustrates a really good point that the other thing about palliative care that I think is relatively unique is that when we talk about an interdisciplinary team and working as a team, we really do mean that 100%. So there are times where the social worker is recommending things to me, or I'm recommending something to the chaplain. We really work together very closely, and no one is on top when it comes to patient care. It's whichever team member is needed the most at that point in time that takes over the leadership role. And it transfers throughout the care depending on what the patient needs. I think it's a really unique part of palliative, and it really gives us an opportunity to focus on everything that the patient may be experiencing and needing rather than just that one disease or that one organ system.
I'm feeling like there's a very strong, mind, body, spirit connection because it's not just, your physical well-being, it's your mental well-being as well. Yeah.
Yeah,
And
absolutely.
even
And
if you're
you're
not religious, there is a spiritual component. So you really are addressing, head to toe of everyone. I like
yeah,
that. Yeah.
yeah, thank you. Yeah.
So to kind of sum things up for people who are listening, if you how would you what would make me say, you know what, I've been to the doctor, I need palliative care. How should I present that to my physician or my family to make sure that I get what I need, what you are offering?
Sure. I would say that anybody who has a new diagnosis or has a chronic complex illness that is experiencing any sort of challenge whatsoever, whether it's challenge talking to your family about it, challenges making decisions about your care going forward, challenges with symptoms or the way that you're feeling, challenges with depression or just dealing with what's going on, or challenges that are about why things have happened and what the purpose is behind all of it,
Yeah.
those are the people that should reach out for palliative care. And I would just say to the physician or nurse practitioner that's taking care of you, look, this is what I'm struggling with, and I really think that the palliative care team would be able to help me get through that so that I can keep focus on my health and on working with you to keep managing this illness for me.
All right. Once again, I feel like we always have to be our own advocates. And you know what? I also feel like you should tell your family that this is what you want too, so that they will, right? So that they are very much aware.
Absolutely.
I think this was really an excellent topic today, and I hope everyone listening learned a thing or two. I know I did. So, of course, Dr. Pasichow's, all his information is there for you if you want to reach out for him. And thank you so much for being with me today.
You're quite welcome. Thanks for having me on. I really enjoyed talking about it.
I appreciate this. Remember out there, if it's important to you, it's important to us. I'm Andrea Tarr. We'll see you next time on Scan FYI. Bye, everyone, and bye, Dr. Pasichow.
So long.